All right. Hello and good morning, everyone. Thank you so much for coming to the 8th annual. That is a long time. That's great. The 8th annual Prevent+Ed Legislative Forum. We are so excited to have you here today as all of our honored guests. Thank you for taking the time. I know that the weather has been terrible. Some of you were homeschooling children yesterday and maybe even into today, and you still made it a point to be here. So thank you for that. We're going to go ahead and get started. We have some of our elected officials on. We have some senators, representatives, and council people on today. So thank you for taking time out of your busy schedule to be here. I'm going to give you all a moment to introduce yourself in just a little bit. But before we do that, I'm going to turn it over to Jenny Armbruster, and she's got a few remarks she wants to make.
Good morning, everyone. Thank you, Heather. Thank you all for being here this morning. As Heather said, this is our 8th annual legislative forum where we just take this opportunity to have conversation and highlight some issues that are important to Prevent+Ed and the field of substance use. So if you're not familiar with Prevent+Ed, just a brief update on who we are. We are a local nonprofit serving the eastern region of Missouri with a focus on reducing and preventing the harms associated with alcohol and other drugs through education, intervention, and advocacy. So we do set some legislative priorities. Being a nonprofit, we keep these pretty broad in the beginning as we set them for an annual basis, really looking at some areas that we want to highlight of concern. So I will share these in the chat. I don't think I need to read aloud to everyone this morning. I think we'd like to reserve more of our time for some rich conversation, but you'll see that our priorities really center around both understanding and elevating substance use disorder as a public health concern, highlighting our lane and our place around the power of prevention, while also recognizing that we have some concerns and we have some crisis that we have to continue to address. Specifically the opioid and the opioid overdose crisis. We know that this continues to be a concern that will take a variety of strategies and a variety of ways that we address communities and the disparities in communities. We also look at other substances such as cannabis or nicotine, and we know that these areas continue to evolve and change, and we need to make sure our legislation and the state of Missouri is keeping up on those and keeping us in pace at the federal level of some of these changes as trends change, as laws change, particularly when we're looking at cannabis, making sure that as norms and regulations around cannabis change, that we're still addressing the risks that come with a substance use disorder related to cannabis, and that we're also protecting our young people in communities who are most vulnerable for development of a substance use disorder if they have access and use to substances earlier. Nicotine and the legislation related to nicotine include things like products of vaping and making sure that we're addressing those concerns, along with age regulation. Last year, the FDA approved that the age to purchase nicotine and tobacco products across the country is 21. Our laws in Missouri still reflect 18. This is very confusing as we work in local communities with merchants and policymakers and young people, and everyone's trying to figure out, wait, what's the law that we follow? What's the right steps here? The other areas in general, like I said, around addressing substance use disorder as a public health concern, really looking at how we can work across this entire continuum of prevention, early intervention, harm reduction, treatment, and recovery to make sure that we're addressing the needs in that continuum. And that also falls in line with our support around Medicaid expansion and the implementation of Medicaid expansion in Missouri to allow us the tools to help individuals access healthcare, help in some of those early intervention of both behavioral health disorders and other concerns, and addressing some, again, of those root causes. We understand that as a public health concern, substance use disorder does not exist in a vacuum or in isolation, and is a concern that covers many different facets, and we have to make sure we're taking a comprehensive approach. So I know that there's some specific legislation that we'll want to discuss as we go through the morning, and I know that our elected officials that are joining have thoughts and opinions on some of these things, and are also maybe have some questions for us, as I know, as I glance through the participant list, a lot of experts on this call this morning. So I'm excited for the conversation. I welcome you all. If anyone has specific questions, and I know Heather will go over some of the logistics, but feel free to use the chat to come off mute. We really are hopeful that this will be a conversation and not just a few voices heard as we go through our time together. So I'm going to stop for now. I'm sure I'll have some questions as we go. It's hard for me to stay quiet for too long, but I'll stop now, and Heather, turn it back over to you. Thank you, everyone.
Okay, thank you, Jenny. All right, and before introductions, I'm going to go over some of the logistics for today. So as you see, you all came in on mute. Thank you very much. And I would appreciate it if you would stay on mute unless you are asking a question. You may ask a question by a raised hand feature, which is on Zoom, and then you come off mute and speak directly to the legislator that you wish to ask the questions to. It doesn't have to be a specific legislator. It can just kind of be across the board. I ask that we have at least maybe 2 to 3 respondents for each question, so we don't expect every elected official to answer every question. So please keep that in mind. Also, I've got some of my colleagues, their names are marked by an asterisk. I've been working on that word. I was saying it a little funky, so I had Jenny help me. But if you need to reach out to any one of them, they are more than willing and able to help. So please feel free to send them a private chat. You can also ask a question directly in the chat. We'll be monitoring that as well. All right. I can't think of anything else that I'm missing as far as logistics. We do know that there are some, maybe some of you all, I know that there are some of our representatives and legislators here today that do have to maybe leave a little early. So we are definitely appreciative for whatever time we have you here for. I just kind of wanted to make everyone aware of that. We have some that will be joining a little late as well. And so we are appreciative of that. Okay, so let's get started. The first introduction is going to go to Representative Gumby, if you would not mind. You're the lucky star. If you want to just share a little bit about yourself, any pieces of legislation that you're working on or you're backing, we'd appreciate it. Plan to give each legislator at least maybe 4 to 5 minutes. So take as much time as you need, but thanks.
Thanks. Hi, everybody. Appreciate the opportunity to be here this morning. My name's Trish excuse me, I haven't talked that much. My name's Trish Gunby. I'm a state rep in the 99th district, which includes Manchester, Valley Park, Twin Oaks, unincorporated St. Louis County, and won a special election back in 2019, reelected in 2020. And so we are now about a third of the way through session, which was brought to my attention a few days ago, which I can't even believe. So a lot has happened on the House side, not as much on the Senate side. I see Senator Williams is here. I'm sure he will give us some insight into that. But we'll see where things go. Some of the things I think that affect this group, you mentioned Medicaid expansion, and we just heard HB 117 that came through trying to take away the vote of the people. And so we'll see what happens with that as that moves through the process. So still struggles for some around expanding Medicaid, getting health care to all our citizens. So that's a concern, obviously, that I have. Personally, I have a bill, a fentanyl test strip bill that I filed, HB 2570. And that has actually generated a lot of interest. I've had interviews with KMOV, KTVI just posted something. Clayton High School, a student there interviewed me. So a lot of interest, obviously, from younger generations and from the news media on something that, while it's being utilized in certain areas around the state, it's not really a statewide program. And this is a pilot program that I heard about when we were not in session, and was mindful of the continuing opioid crisis and drugs being laced with fentanyl. And we just heard a couple of weeks ago about the 7 people who died in that apartment building. So I think it's very timely. I think it's a way for people to at least recognize the drugs that they're using could kill them, literally, and, do something before they're able to seek treatment. So I'm actively trying to find a Republican in the House to sponsor that. I'm mindful that my legislation will likely not move, so I have to find a Republican. I've talked to 3 different individuals and am waiting to hear back on that in the hopes that it'll get, it'll get heard in committee. And certainly living through the pandemic, we know that substance abuse has been on the rise, and that's something we have to address as we are now hopefully coming out of it in the coming weeks and months. So just excited to be here to hear what my colleagues are also doing, but really just appreciate the great work that Prevent Ed does, and continue to advocate for all that you do.
Thank you very much for that. Senator Williams, you're next on my screen.
Good morning, and I don't think Representative Gumby could have really stated it more clear. It's very fascinating to see in the Senate. There's a lot of fireworks. That's usually the more deliberate body. So we usually get our entertainment from the House, but this year, so the tables have turned. But I do want to again thank Prevent Ed for the opportunity to be here this morning. I participated in this panel many times before, and I've always went away with very optimistic views on how we can make our state and region better, but also just remain grateful for the work that you all do, as well as the advocates and thought leaders that operate in your space. For those who are not familiar with me, I serve as the Assistant Democratic Leader in the Missouri Senate. I represent District Majority St. Louis County. I consider it the model for the state of Missouri because I represent some of the wealthier communities like Clayton and Ladue, but also represent some of the more poverty-stricken ones like Ferguson, where I grew up. So it's a very diverse district, very proud to represent it. And then also, it's good to see a lot of my colleagues on here as well. My district has businesses, seniors, we have families, we have individuals with substance use disorders. In the past, if lawmakers were talking about these individuals in the Capitol, they'd be talking about criminals and addicts. But so much has changed over the years. I'm excited to see that we're now finally breaking stigmas and making progress. Today, leaders have a better understanding of the behavioral health issues underlying these conditions, and a better understanding of the positive steps that we can all take to help get people healthy and safe. Last year, the Missouri Senate passed legislation to distribute clean hypodermic needles or syringes to prevent HIV, viral hepatitis, and other infections. Now, that's 30 years of statistics showing syringe access programs lower the number of users. In fact, I saw a study out of Seattle that found that people who interact with the clean needle program were 5 times more likely to enter drug treatment programs. Now, that makes sense. Once people with substance use disorders have a place to go where they can take a health provider they trust or talk to a health provider they trust, they will take the first step on the road to recovery. And that's what we're looking to do. This legislation didn't make it out of the Missouri House, but it made tremendous progress in what is always a very long process. One thing that did clear both chambers and make it into law was the long-awaited prescription drug monitoring program. Our new statewide prescription drug monitoring program would help doctors avoid accidentally prescribing opioids to people with addiction. It would also help connect their patients with drug treatment services that they need. And then also prevent doctor shopping. So as a state, I truly believe that we're making progress, and I believe there's always more work to do, but I'm glad to have each of you as an ally in this fight. It really means a lot. And again, I won't stay on long. I get 1 day out, 2 days out of the year that I could kind of put my job on the back burner. That's Christmas, which is my mom's birthday, and then February, which is mine. So I'll be doing some things with my family. But again, thank you for having me here today and for all that you do to make Missouri safer and healthier for all.
Thank you, Senator Williams. Maybe I was reading into it. Did you say today's your birthday?
Well, yeah, yesterday was my birthday,
Oh,
but we're gonna
okay.
celebrate
Well,
today.
happy belated. Thank
Yeah,
you.
the weather gods must have gave us a needed break, you know.
Yeah, yeah. Okay, Representative Unsicker.
Good morning. Yes, I'm State Representative Sarah Unsticker, and I represent the 91st District in the legislature, which is Webster Grove, Shrewsbury, Crestwood, a little bit of St. Louis City, and Marlboro. And I have served since 2017. I am also policy chair in the Missouri House. Before I ran for office, I practiced law. I did family and education law, and I was a guardian ad litem in the Family Drug Court in St. Louis City, which is a program I was very proud to be a part of, because what we did mostly is we worked with moms who had substance use disorder, and we worked to get them clean and sober, and to get them jobs, to get them stable housing, and to get them reunited with their families. And that was very important to me, and I'm very proud of the work I did there. Right now, what I'm working on mostly is foster care and domestic law issues. We passed House Joint Resolution 117 out of the House last week, I believe. And I'm very much opposed to that. That one is going to destroy Medicaid expansion, which Medicaid is something I'm very passionate about. So I hope that the senators will be able to stop that bill. And I guess I'll take any questions, or you can move on. Thanks.
Okay, thank you. I'm sure we will come back to you. Let's see. So I think Senator May will be back in a moment. So if you can hear me, Senator May, whenever you're back and you want to kind of do your introduction, that would be great. Just let us know. I see Councilman.
I can go.
Go ahead.
I can go ahead now.
Okay, sorry.
No problem. Hello, everyone. I am so glad to be here. Thank you for the invitation to participate in this forum. I have been in the Missouri legislature since 2010. I got elected in 10, sworn in 2011. This is my 4th year in the Missouri Senate right now. Prior to that, I was involved in community activism in my community and in my neighborhood, and that's what allowed me the opportunity to serve at a higher level. First of all, I am very passionate about what we're talking about here today, and especially when it comes to being an advocate for alcohol, drug, and intervention. I've participated in many of those efforts, and I still am a person that helps individuals who are struggling with abuse and struggling with drugs currently. This year, the main thing that I filed, and I do apologize that I don't have my camera on because I am actually, in a place where I'm in a doctor's office, so I want other people to be, exposed, their privacy exposed. So I just wanted to let you know that. Two of the bills that I'm very, passionate about right now and that I've been working on since I've been in the House has been mental health. And so this year we're doing a mental health awareness bill for students training, and a Senate concurrent resolution as well to do a mental health awareness for students training. These are the two bills that I'm working on, because what we have to do is put mental health awareness on the forefront, especially with our kids, especially what's going on with this pandemic, and especially in the schools. I was able last year to get the pilot program that I have been working on since I've been in the House to come to fruition. We did a private partnership with People's Health Center and the Missouri Foundation for Health and the Department of Mental Health. It's a $1.5 million partnership where we are offering what we call mental health evaluations to children who have been impacted through mental health by gun violence, who have been affected by gun violence. So we're letting those adolescents come into the behavioral health center and be treated for that. So this is something we want to do. We want to make sure that we make it aware in the schools, in the high schools and the elementary schools as well. So it will not be a taboo among our families, because we have too many people who are silently leaving us through suicide and through bipolar disorders and things like that. And silence is not our victory. We have to make it aware, and it has to become a point where it's not a taboo. So I just wanted to give you that update. Again, thank you for the invitation. Again, kudos to all of my colleagues who are on this line right now, who are fighting the good fight right now in a very, very controversial legislature this year. Thank you.
Thank you very much, Senator May, and no problem at all that your camera is not on. I think we've all been there. So just thank you very much. Let's see, I don't want to put you on the spot, Councilman Wilson. Would you like to kind of give an introduction? Okay.
Sure. Good morning, everybody. It's great to be here. I am Terry Wilson. I'm a city councilman in the great city of Jennings. I also previously served 10 years on the Jennings School Board. And my passion is youth, and my passion is being proactive. And so it is wonderful to see some old friends. I work in my day job at Beyond Housing. I'm the director of the Paysdale Family Support Center, and we have a great relationship with you all with the Red Ribbon program. And I'm very, very proud of the things that you all do. And I think it's very important that local legislators are engaged in the things that are going on that we may not necessarily make legislation on, but I believe that it is very important that local legislators are engaged and on the same page as the state and the federal legislators, and partners with organizations who are actually on the ground doing the work. That way we are informed, especially when issues come up, we're informed about those issues. And it's like, it's wonderful to have organizations like you all on the ground doing the work. And I am behind you guys 100% in supporting all of your efforts, because like I said, I believe in a proactive stance as well as prevention and intervention, but proactive. If we can scale up education in terms of being proactive, I think we can solve a lot of these issues that we have going on right now. And so I'm just glad to be here. I'm glad that I was invited, and I'm ready to learn and listen and take back what you guys give today to my community, so we can make things better around here. So thank you again for the invitation, and I'm ready.
Thank you very much. Okay, I've got lots of little squares on my screen. Is there anyone else that I missed? Anyone else from the council or representative, senator, anyone that I missed? Feel free to speak now, or you can chat me. I think we may be good. We may be good to go. Okay, so let's get started with our question and answer portion. Again, we're going to ask the questions, raised hand. You can ask by chat, and we'll just ask if we could have maybe a couple of people respond to each question. So is there anyone that would like to go first? Anyone that has a question? Did you just wake up this morning ready to be the first one to ask your question? Anybody went to bed thinking about the question you were going to ask today? Okay, if not, I have a question that I can start with. All right.
I see Ellis has actually raised his hand, Heather.
Oh, okay. Thank you. All right, go ahead, Ellis.
Good morning, everybody, and thanks for attending it. One of the questions I have, I know recently Missouri has been awarded a huge settlement that's earmarked strictly for treatment, abatement of the opioid epidemic and such. Has there been any talk in legislation about safe injection sites? I've read an article about the one that was recently opened up in New York, where within the first week they saved an amazing amount of lives. And this also opens up another path to recovery. And I just was wondering if there's any talk in legislation about safe injection sites. Thank you.
Well, can I answer that?
Yes, go ahead, Senator May.
Okay. So when I was in the House, I filed a bill for safe injection sites. They were very popular in Europe. They have been very successful in Canada as well. But we were not able to get the Missouri legislature to see the benefit of what we call them safe consumption zones and sites. That's what they called them in Europe and Canada, safe consumption zone site. So I have not approached it in the Senate, but I do intend to file it at the end of this year. This is an election year, so it's very difficult to do a lot of legislation because you're in the process of running for re-election. And so I am planning on filing that bill and getting it done if I possibly can get it across the finish line.
Okay, thank you. Great. Anyone else want to chime in on that? Okay, I see. Oh, was someone else speaking?
I just see a couple of hands raised.
Okay.
Yeah, I think Dr. Punch had a question.
Okay, go for it.
Thank you so much. So a step before safe use is syringe exchange at all. We know that there's Bill 690 by Holly Ritter. It has been out there in the Senate. This is a public health, completely established, best practices, evidence-based, no question issue. The country has decided, the CDC has decided, best practices. It is currently not legal in Missouri to do syringe exchange, so we're basically saying it's okay to allow for the spread of infectious diseases and to not engage people with real talk and real access to safe use supplies as they're using. So a step before sort of, injection area sites where we could have supervised use or safe use, can we talk about getting needle exchange legal in Missouri?
Thanks for that. Anyone have any comment on needle exchange? Okay,
Senator I was just curious if the senators had any. I know in the House, I'm not aware of any legislation, but I've heard of her, so I didn't know if they had an update around that.
Yeah, one, I was aware of Holly's legislation, and I'll be in full support of Senator May when she files that legislation next session. Right now, as Trish stated earlier, we haven't brought up a calendar yet for legislation, which is very unusual. But those type of things clearly happen. But any legislation that would address that particular issue, I would be in full support of. I think it really moves our state in the right direction. But again, unfortunately, there's, with congressional redistricting and a couple other pressing issues that we've been working on, we haven't been able to really dig into pieces of legislation, unfortunately.
I do want to just note that there is a House bill for a hypodermic needle syringe exchange program. It's House Bill 1844. It doesn't look like it's received much action. The last time it had a second read was on January 6th. So there is some comparable House bill that has been filed with the Senate bill as well, just to keep that on everyone's radar.
Jenny, what was the number on that House bill, please?
Yep, House Bill 1844.
Who filed it, please? Just curious.
Senator Stevens, or I'm sorry, Representative Stevens, Martha Stevens. I'll share the link in the chat.
All right, thank you for that, Jenny.
And also keep in mind, Senator May and our staffs is on here as well. So, you know, if you put something in the chat that you want to put on our radar, we'll be more than happy to look into it. And, you know, and address some of those concerns. You know, if there's not any legislation that's been filed or it's something that you would like for us to focus on particular, but we can all circle back and look and try to create a pathway.
Great to know. Thank you. Yeah, I see lots of links going up in the chat, so be sure to look at those. Okay, do we have another question? Melody, Quinn, I'm looking at you. Your hand was raised earlier. I didn't know if you had another question or a comment.
Well, it was really more a comment slash question, and I was more clapping for Dr. Punch. So I was wondering if having particular facts for our legislators would be beneficial for them. For instance, syringe access programs are completely grant funded. They are not federally funded. They're not allowed to be federally funded. So it doesn't come out of tax dollars. So if there's a monetary issue, you know, there are grant or organizations that offer up grants specifically for that, like the Levi Foundation and things of that nature. Plus, in the state of Missouri, approximately 15% of our inmates come in with Hep C. And we can't allow our inmates to sit in prison positive. So they have to treat those, and that is tax funded. And that is approximately $75,000 per case. And a syringe is 7 cents. So monetarily, it doesn't make sense not to have syringe access. It's not even a moral thing. It's a cost thing. If we can help our citizens with 7 cents rather than having to spend $80,000 approximately to fix an issue that they're going to get, that kind of information, I don't know if that would help when you're going to promote these House bills or Senate bills, but it's a financial savings for everyone.
Yeah, Melody, if you could provide that information, and we can definitely look into that. And then keep in mind, you know, right now we have a record surplus, and clearly a lot of that is because of the federal stimulus funding that has come to our state, and we're anticipating more to come. We can look into some creative ways to partner with organizations on the ground that can provide these particular services, but yet we close the gap that we've seen, which has been lack of access due to financial resources being available. So, you know, there's a lot of ways that we can do this, and I'm not convinced that everything needs to be done through legislation. I think a lot of it needs to be done through action and being intentional about these things. And if there's a way that we can provide resources from the state level or even local level, let's look into some creative ways to do that. You know, I'm on the board for a community health center, and you know, I'm always listening and figuring out ways to be able to provide them with the resources to really do what they do every day.
Great. Any other comment on that question or statement? Okay. Don't see one. All right, does anyone have another question? If they're prepared.
Heather, Craig put one in the chat.
Oh, okay.
It's not a question. I was just adding on to that. That was going to be my question, and Dr. Punch got it as usual. Thank you, Dr. Punch. Yeah, I know the City of St. Louis Department of Health has been looking at this for quite some time, and Holly Rader was part of it. Chad Sabor down in our neighborhood has been looking at it as well. So it's hepatitis C is a huge issue, and the cost factor that you indicated, Detective Quinn, is a significant one. The cost not only to the community, but for individuals, obviously.
Thanks, Craig. Okay. I had a question come in, changing gears a little bit here, but what is the temperature on recreational cannabis?
I
In
will
the
just say,
legislature
I
not
could-
existing.
Well, I filed a bill to give, when I was in the House. I filed a bill when I was in the House to do recreational all the way around. But like I said, at that time, and they're still not ready for it. The legislature is still not ready for it. That's why we had to do it by initiative petition to even get medical marijuana. So when you're talking about these things, they don't want to go on record as voting for it. So mostly it'll probably be done by initiative petition. That's how you'll probably get it done.
Okay.
which would probably mean, given the assault on the initiative petition process, it won't get done. If that happens to pass the legislation that's going through.
Well, let me tell you this. This is not the first time that they've done that. So when after they had the puppy mill bill, at first you used to get signatures from anywhere in the state. It didn't matter. They attacked the initiative petition process by saying you had to get a certain percentage from the 8 congressional districts. Now they're trying to do something more. We beat them then. I mean, we'll beat them again on the ground. Because like I said, at first you didn't have to get signatures from the 8 congressional districts. You can go into 1 congressional district and get all the signatures you need. So the legislature then made it difficult by saying you had to get it from all 8 congressional districts, a certain percentage. Now they're trying to do it again. If it comes to the Senate, we'll stand the filibuster. They'll have to PQ us on it. So we're not going to just let it pass. But even if they do PQ us and get it passed, we're still going to beat them on the ground. They're not that smart.
Okay. All right, Senator.
That's why that's exactly why we're not taking up bills in the Senate.
I'm just envisioning Senator May at this doctor's office with like this whole conversation. I'm loving.
Yeah, I gotta see her on the Senate floor.
Yes, they think I'm crazy right now. Everybody keeps saying, who is she talking to?
So funny. Well, we appreciate it. Okay, did anyone else have any comment on that?
I just want to say I have constituents that email me and ask for its legalization. So I'm more pro than con.
Yeah, and then that also is a little off subject. I do a lot of work around criminal justice reform, which I changed the expungement law, which would now make it easier for folks to get their records cleared. And I think this would be another step in the direction for people who are or maybe have been incarcerated for possession of marijuana. So I think it's a game changer in a lot of different aspects.
Okay, great. Anyone else? Yeah, for sure. Ellis, I see your slippery slope comment. What else? Yes, Alexandria.
Hello, I have 2 questions. One is related to, there's a few people on here sharing evidence around certain practices. I'm curious, what groups or individuals do you go to when trying to make an informed decision about whether or not to support legislation? For example, with the syringe exchange, obviously CDC has policy briefs, a bunch of health-related organizations have policy briefs. So I'm curious who your go-to people are to learn more about these things. And then my second question is around drug decriminalization. Nationally, there have been 10 states that have introduced drug decriminalization, with Oregon being the first to pass it. I'm curious if you think that's something that would ever happen in Missouri.
Great questions. Thank you. Go ahead, Senator Williams. It looks like you were getting ready to comment.
Yeah, I think, okay. Yeah, it looked like Senator May wanted to jump in.
Sorry, Senator May. Go ahead.
Well, The only thing I was getting ready to say, you know, most of us, we have a go-to is, you know, we have the National Conference of State Legislators and the National Conference of Black State Legislators who have all of this information about statewide legislation all over the country. And that gives, you know, information and does research for you. You can call any of those offices, get that research, and they'll respond to you and give you the information on legislation and statistics to go with it. So that's how we get, you know, information. If any other legislators are not utilizing that, I suggest that you utilize that. So there's other advocacy groups out there as well, especially when you're dealing with different types of things like the environment. You have the Environment Coalition, you have all of these different entities that we get information from. So we're not just left without getting information. Plus, each Senate and House has a research department and a research library that we go to get information. So I hope that answers the question. There was a second part of the question, but I forgot what it is. I'm sorry.
I'll answer this. I'll answer the second part of the question. Senator May, she touched on it perfectly. The only thing I'll add in terms of that, if you look in the chat, you see Gregory Smith just talked about the Missouri Coalition of Recovery Support Providers having a recovery day and a lobby day. We get a lot of different advocates and groups that come up to the Capitol that we meet with and get statistics and data and information pertaining to various issues, including this one. In regards to how do we decriminalize folks who use drugs or maybe have used drugs at one point in time in our state. I think it starts with really just tackling the criminal justice reform, you know, just addressing laws. So for example, last year, I passed legislation that changed the expungement law, which made it easy for people to get their records expunged who may have been charged or arrested for possession of drugs. We've also worked on partnering with various institutions to do expungement clinics. I have legislation now that I'm looking to package with that bill we passed last year to create a central database to make it easier to streamline expungements and folks that are unable to pay the cost to be able to have that that petition filing fee waived. So, you know, there's a lot of things that we can do to address that stigma around folks who have been incarcerated or arrested for having an addiction problem. So, you know, I think that it's something that we're working on now. I think it's moving in the right direction with the bill I passed last year, which was a sweeping criminal justice reform bill that I think we'll continue to build on. And to be able to do it in a majority Republican legislature shows that there's an appetite there. But also there was a poll that they put out throughout the entire state. And it also stated that there is a lot of folks, Republican and Democrats, who are receptive to decriminalizing a lot of these things in terms of drugs and even nonviolent offenses.
Thank you.
Anyone else for that?
Yeah, I'd like to jump in here.
Okay, go ahead, Representative.
I don't believe that drugs should be decriminalized, but even more than that, we need to work on our mental health resources. Missouri ranks at the bottom for availability of mental health resources and access to mental health. And I think, you know, to decriminalize drug use without improving our access to mental health would be not the thing to do. I think it's most important to increase access to mental health services. So.
Thank you for that. Anyone else on that? Okay.
Yeah, Dr.
I'll
Punch,
just-
Oh, go ahead, Representative Gumby.
Oh, no, I just want to add, you know, a lot of, I mean, I've signed up to get a lot of emails from a lot of groups, yours included. And so obviously days in the building help when you stop by our offices, but just those emails, I mean, I read all of that. I put those that information in my weekly report. So when you have events that would pertain to, you know, those in the community and perhaps not professionals, that's helpful. The other thing is, you know, all the emails we get from constituents and from different groups. I mean, a lot of times I find out about what's important to people through those emails. You know, we kind of get in a bubble in terms of what we're doing sometimes, and your constituents let you know what's important, or at least what's moving. And so some of those are very organized and are, you know, robotic, and you get the same email over and over again, but others aren't. So we keep track, and I would imagine other offices do too, you know, what people are emailing about, what is their concern about. And so just to be mindful of that. Sometimes constituents know things, you know, ahead of you. So
Right.
that's one tool I use.
Great. So you're telling us the copy and paste feature should not be what we are sending you. The templates we all have is probably not what we should be sending. Okay, Craig, I thought you were going to comment.
I was just mentioning, I saw Dr. Punch's hand up. I didn't know if it was on this issue or the next one.
Okay. All right, Dr. Punch, go ahead.
The issues that are being discussed are just, they're so important and they're so essential. The word criminalization and the issue of mental health, there is a higher discourse that you as elected officials can bring to this issue, which is the issue of stigma, being a barrier, not just to the issue of criminalization of drug use, but a barrier to mental health access as well. And in Missouri, right, we have to recognize that this is also disproportionately being experienced in Black bodies, as Missouri leads the country, or is almost near the top, in Black people who overdose. And St. Louis as a region is responsible for around half of Missouri's overdoses, and Black men in particular in St. Louis are experiencing those overdoses at extremely high rates. More folks died from overdoses than COVID in 2020. So what my question to the leadership, to you as our elected officials, is how can you and how will you commit to attacking the discourse, right, around this issue, and bringing to light and ending the literally fatal stigma that's around both how we think about people who use drugs and not recognizing it as in and of itself an expression of trauma, and the stigma around getting help. This is the discourse that this incredibly capable group of people is capable of having, right? But if we don't go there, then we will only be talking about shuffling around, you know, some very important bills, but not actually moving the needle, no pun intended, around how people are experiencing this problem in the state of Missouri.
Well, I definitely want to address that, because I think that, you know, and I thank you for that observation and that insight, because, you know, one of the ways that we definitely, Senator Williams and myself, we sit on appropriations in the Senate. And so we have a lot of different agencies and advocacy groups that are funded, that those groups are the groups that are handling what I call, you know, advocacy and help and assistance to people that use drugs and abuse drugs on the ground. And we know that we've increased funding for those agencies across the spectrum in Missouri. So I know that I can't say specific because I don't have my budget list in front of me from last year, but we did fund those. You know, I know that I sent $54 million to the ground last year. And I can't even say how much Senator Williams sent to the ground. So the way we support them is we have to make sure that dollars that are in the state budget flows through to those agencies that support that, to those specialists and those people that are professionals in that realm to support that, those individuals who need that help. Also, to say this too, the Department of Health and Senior Services, you know, that has increased where we have roving opioid vans, and the Department of the Minority Health Initiative too in St. Louis has really, you know, upped their game in, you know, being on the ground, being in the streets, you know, trying to get to those individuals with what they need before, when they have an overdose situation and addressing those overdose situations. So if there's any other way that we can help, we would love to be involved and be a part of it. Because I know that I speak at a lot of these different events and things like that. But the biggest way is through funding. So help us figure out another way to do it. And I think we can do it.
Yeah, I think Senator May really hit it on the head. But keep in mind, there's another layer to it. We have to make sure, and we spend more time in the appropriation process, not only trying to get money for our region, but also making sure that we're targeting institutions and partners that are culturally competent. And that we got to be real about this. We're not exempt from any of the challenges that impact our community. I'm sure Senator May and I and other colleagues could give personal stories on how we have people in our families and neighbors and folks that are close to us that are impacted by this. Dr. Punch, you lived in a part of my district where folks were overdosing, and that's before we even talk about the social determinants. So we have to be very intentional about taking what I consider a once in a lifetime opportunity with this federal money coming in to really target partners, institutions that are culturally competent. And I guarantee you, Dr. Punch could spend countless hours talking about how many people of color, particularly women, who go into healthcare facilities and are told that they are experiencing things that they're not. So, it's such so many elements to this, but I think from the macro perspective is making sure the resources are there. And then once we get to a more intimate space, making sure that those resources are going to the right communities and that they are getting to folks on the ground where they feel comfortable seeking out those services.
And I want to add, I fully agree with what the senators said. And also, I think it's important. There was a website shared earlier about person first language. And I think it's very important that we use person first language and that our words and language work to destigmatize drug use and especially to destigmatize addiction. So that is something we can work on with our colleagues to teach them better ways to talk about addiction. And that's something that we can work on. And every time we talk to the community about it, we need to make sure that we use language that destigmatizes addiction. So, and any other ways, I would love to hear any other ways that we can help to reduce the stigma.
Right, absolutely. Thank you for that. Thank you for that. Go ahead, Representative Gumby.
Well, I just want to add, I'm not on budget, but one thing, any group that comes to the House, if you can't get somebody to meet with you, and by that I mean a Republican, I'll just put that out there. If they aren't willing to sit down and hear what you're advocating for, I would come and I would ask to pull them off the House floor. That's a way that typically they will then at least hear what you have to say. You don't have to sit down in their office. I would go and look on the budget committee, find those Republicans who probably need to hear this message. And then when you come to the House, pull them off the floor and share your story with them. There are other groups that are having difficulty getting in to talk to certain legislators, and that's just not right. So there are ways that you can navigate kind of the system and at least be heard in some fashion. But for us, we just need to convince Republicans to increase funding around these areas so we don't continue to have these floor debates. And I would imagine in their communities, there are people that you partner with that for whatever reason, they're just not getting that message. So I would find partners in those more rural areas, smaller, suburban or urban areas, and find ways when you're in the building to nab them when they're walking to their office or pull them off the floor so that they can hear you.
Okay, thank you. We're taking notes, Representative Gumby, on on the ways that we can, be better advocates for sure. All right, thanks, Dr. Punch, for that question. That was great. I saw a raised hand from Lindsay Kahn, and then it kind of went away. And I don't know if you no longer have a question or if it just faded away on its own. Anybody see that? Lindsay? Okay. But we'll come back if she asks her question. Does anyone else have a question? Comment? Okay. Guess the next thing, Michelle, go ahead. Michelle Wright.
I'm sorry, I had to unmute. How are you this morning, everyone? I do have a question. I'm interested in finding out, are there numbers for seniors directed that are affected by substance abuse or the issues that we're speaking about? I know we were talking about health and senior services, but are there any numbers for directly for seniors?
I'm not sure. You mean as far as like statistics on?
Yes, statistics for seniors.
I'm not sure if anyone on the call has those.
Does anybody, I've done work with, out in my district, out my way in West County, there's an aging ahead group. And I know that those agencies are around the area. They may have specific statistics for the senior population. That just comes to mind for me.
Yeah, and the silver-haired legislature, they keep they follow a lot of legislation and things pertaining to the aging population throughout the state.
Thank you all.
Okay. Stacy.
Hi, thank you. I don't mean to make a rewind here, but I saw the comment from Amanda in the chat box about the increase in pediatric marijuana exposures. And I also wanted to add that I am a little surprised we kind of went through that topic of recreational cannabis so quickly, but I feel like that kind of also reflects like the tone of the state and what it sounds like the legislators are hearing. So first of all, in terms of policy, we definitely articulate the differences between supporting decriminalization versus commercialization. And most organizations, including ours, would be in support of decriminalizing cannabis, that nobody should go to jail for that. But talking about the commercialization of it is sometimes a separate topic. And so Amanda mentioned something specifically, this increase in pediatric marijuana exposures. And we've also seen some other things happen since the medical program was passed. There was a story in KSDK yesterday about a local mathnasium center who's concerned about a dispensary being built near their building. And I'm not going to go into the reasoning for it, but what it points out is that there's not a lot of local control for these things. There's not a lot of room to address emerging public health threats or even to identify them. So I think if I could, sorry, I'm already taking too long. If I could rewind to that question, what is the temperature on recreational cannabis? Are we identifying like some of these things that have popped up? Is that on the radar of legislators? Is there room for improvement that we saw with the passage of our medical program of maybe here's some things that we'd like to do differently if we were to pass recreational?
Thanks, Stacy. Anyone have any comment on that?
I'll jump in here. I think, first of all, I really appreciate you talking about the difference between decriminalization and commercialization. That is not something that I have really thought about in the past, and I think that's a very important issue to separate the two topics. As far as use and pediatric overdoses, or at least pediatric poisoning from marijuana use, or from parents who use marijuana, I think it's important that we educate people on the dangers of letting children be exposed and on safe ways to store their drugs.
Absolutely. Any other comments with regard to that? Go ahead, Amanda. Did you have another question, or was it a comment with this one?
No, just to highlight that a little bit more. Yeah, we certainly have seen a daily uptick of marijuana cases involving young children. So just, you know, not our teen users, which we've seen increase as well, but just the under fives that are getting into edibles and other products in the home. So it's certainly in our radar as we've seen home use more prevalent. So we're certainly concerned about, once it becomes recreationally available, how much more we're going to see, and how much we have seen in states who have made it available in states of Colorado and Washington. So just maybe some potential legislation around safer packaging, safer, you know, warning. Washington has made some warning labels on packaging with certain demarcations on it. So we're happy to provide data. We collect all that. We're a passive data place, so people don't have to call the Poison Center, but we certainly probably have the most extensive data for overdoses in the states on people who end up in the hospital, pediatric exposure. So if there's anybody who needs that information, we're willing to provide that for, you know, work together on that. So feel free to reach out to us if that's something that helps the cause. We're happy to do it. So.
Great. Amanda, if you wouldn't mind, did you put your information in the chat?
I will.
Sorry,
I will do that. Thank you.
It's shrunken on my end, but yeah, I definitely think people are going to want to reach out about that. Melody, go ahead.
Just to piggyback off of what Amanda said a little bit, and I'm kind of sad that Councilman had to leave already because it's about Jennings. But I know that they are having an increase of edible cannabis issues in their school district in Jennings. So much so, and if for those that don't know me, I am a detective with St. Louis County Police Department, but I also work in the prevention realm. And we there is a lack of information, there's a lack of understanding, and especially for our juveniles, there is a lot of confusion as to how something is bad and illegal and criminalizing, and now it's not bad. It's in fact has benefits in any form, which I hesitate to agree with, and that it's so accessible that the understanding of cannabis in and of itself needs to be better described, I guess, to our juveniles. And I have to agree with what Ella said. It's kind of a slippery slope in regards to just simply understanding. And I don't know that there was enough understanding of the legislation when the amendment was changed, and that will never become unchanged. So, you know, I just think that it's vitally important that we get some really clear understanding of what those laws are and share that with our young generations, because they are terribly confused.
Yeah. Senator May, were you going to comment on that?
No, I was trying to figure out how to lower my hand. It just did it by accident.
Oh, okay. Okay. Craig, I saw your hand up too. I wasn't sure if you were
Yeah,
going to comment.
Stacy, first of all, thanks for the rewind, and also thanks to Amanda. You all have a lot of great information. I don't necessarily always avail myself of that, but I do know that it's out there. So thank you for that. I'm not sure entirely, and I'm glad that the legislators have some of the access to this. But I think, yeah, what Detective Quinn was talking about in terms of the messaging is a difficult one, right? So, and I know there are some responsibility laws, obviously, and for someone who's an adult who can make decisions like this and they're over age 25 when the brain has been fully developed and so forth, there are a lot of public health implications, I think, potentially for just in our effort to bring the state of Missouri maybe into the 21st century. Sometimes we unintentionally neglect some of those adult responsible things that maybe we could do to avoid some of these unintended consequences. And so I appreciate this discussion, and hopefully as Missouri moves in the direction that they seem to be moving, that they will obviously look at this, because as Detective Quinn said, our young people are really looking for that direction, I think. So.
Yeah. Well, Jamie, I'm not sure of your question, but I feel like Craig, speaking of young people, probably was a good segue to something you might mention. So you're on mute, but unmute. Go ahead.
Thank you. And that was exactly it, the young people. And so I am a prevention educator with Prevent+Ed, but I also have the privilege of working with our youth coalition, Elevated, and then our advocacy event, Hear Us, where in just a few weeks, our young people are going to be having appointments with a lot of our senators and representatives that are here with us today. And that's very exciting. Senator Williams and Senator May, expect phone calls to your staff or emails to your staff shortly. But one of the things that the students and I discuss on a fairly regular basis and that crops up in classrooms constantly is this perception that it's just marijuana, like, oh, it's just weed. And one thing that our young people have encountered time and time again, and going back to what Craig just said, is that sometimes this attitude is pervasive amongst the adults as well, without really taking the time to investigate. And I will throw myself under the bus and say, prior to becoming employed with Prevent+Ed almost 10 years ago, I would have had the same attitude. I did not know. I thought I was informed and I was not. And there are so many consequences that can occur with cannabis use disorder, or even just cannabis use, even if somebody doesn't develop a disorder with it. The slippery slope comment like resonated deeply with me, and we try not to use the term gateway, but it is one of those things that you start with something you think is no big deal and can move very easily into something that is a bigger deal, or that thing that you thought wasn't a big deal becomes an issue. Most of our students that are in treatment are there for cannabis use disorder. And Jenny Armbruster could probably give the statistic on how many students come through our guided program, but recently reported that most of them are there for cannabis use disorder. So I think an education program in place, something that is already set, or expanding, not to toot our own horn, but expanding what we do, or, making sure that there is some type of truth campaign like we have with tobacco surrounding cannabis before we just, push play on recreational cannabis. I think that something like that is vital to protect our youth, because, I don't remember who said it earlier. I think it might have been Senator Williams. And if I'm miscrediting somebody, I apologize, but it's much easier to prevent a problem than to try to deal with the consequences of a problem. So if we can stop it before it becomes an issue through education, that would be paramount. And I will say, to the credit of our young people, when we have open and honest communication, when we provide them with facts surrounding not just cannabis, but any drug, they make better choices. They are very thoughtful. This group of young people is phenomenal with information. So they will surprise you constantly, and do with me on a regular basis. it's one of the best things I get to do is give them information and see that light bulb go off of like, oh, so this could have consequences, and like to have those meaningful conversations. So an education program, this isn't really a question, but I'm advocating very, very strenuously for anyone supporting a recreational cannabis program or looking at how we can reform our medical cannabis situation here in Missouri. Let's get some education, not just for the kids, honestly, for the adults as well, because again, lots of us are uninformed, but truly for the sake of our juveniles, because those adolescents are so vulnerable, but need the information.
All right. Yeah, great points. I mean, we know prevention works, and we definitely do know we have an awesome group of young people that are information seeking. You know, gone are the days when, you know, we had a lot of scare tactics and things going on that people thought would work. They definitely need the information. So thanks for that comment, Jamie. Does anyone else have any comment on that? Any other question? I'm thinking of something I don't think we've brought up yet, and I don't even really have a question. I guess it's just a phrase, but tobacco 21. Is that like a mic drop moment? I don't have a mic, but it's like a mic drop moment. What are we thinking about that?
Can you describe again, just for anyone who wasn't on at the beginning when Jenny was saying what tobacco 21 means?
Oh yeah, sure. Jenny probably had it all stated more clearly than I can, but tobacco 21 laws are not statewide, and it's really just saying that youth cannot purchase any tobacco products until they are 21. We have a lot of conflicted youth because some places they can purchase products at 18, some places they can purchase products at 21, and we really want it to be more uniform, and it should be. Jenny, was there anything else that you wanted to add about it?
No, just at the beginning. Well, yes, I guess I say
no.
No,
Okay,
and yes. At the beginning, I highlighted that really the federal law has changed that requires individuals to be 21 to purchase tobacco products.
Right.
Many of our local cities and towns or counties had already really moved in that direction to be 21, but the state law is still 18, and the state law is so prescriptive. It's not only 18, it also says there has to be signage in locations that state you must be 18 to purchase tobacco, and the signage has to be hung in a certain place and certain dimensions. So we have a lot of confused merchants and community members and young people who are hearing and are being checked through the FDA that you have to be 21, but then are also now required to hang signage in their locations that say 18. And it just makes our job in prevention and educating communities much more difficult as with this layer of confusion, and not only in a education and health perspective, but then also when we look at from an enforcement standpoint, and we're looking at supporting our local communities on how we can hold people accountable to make sure they're following the law, and then people aren't sure exactly what the law is. So the federal law is 21. People should be 21 to purchase tobacco products, and our laws in Missouri are not keeping up to that federal level. So, you know, I'm not a policymaker, so in my, you know, naive brain, I think, oh, this is very easy. We pass a law that says 21, and it's proven more difficult than that over the last couple of years. So I have not seen any legislation that is even being proposed to change Missouri law, and I would just be curious if anyone has heard any other rumblings or rumors or reasons different than what I'm sharing.
Thanks, Jenny. Do we have any legislators that want to comment on that?
So I support the tobacco 21 legislation, but I understand that every time it's being brought forth, there's some language being added to the bill that makes it easier to access tobacco, and I don't remember exactly what that was. But that seems to be a push that's getting onto the tobacco 21 legislation in Missouri. And I know the American Cancer Society is locally has told me they would rather just leave it alone rather than get involved in that, just because of that additional language that's being added onto the bill.
Okay, do we have anyone from the American Cancer Society? No, I'm just joking. We don't want to put anybody on the spot, but I'm not sure if we were aware of all that information. So thanks for bringing that to our attention. Anyone else? Any other community members want to speak on it? Anyone having any issues in your community with conflicting messages regarding federal law versus state law? Melody, that's just a head nod and not even gonna go there.
Yeah, I mean, I know some of them aren't on here, so I know we've had problems in some rural counties that some of our coalitions work with, where, I mean, even law enforcement thought that it was still 18 to sell, even though federally it is 21. So not only are there's confusion amongst retailers, young people, but sometimes in really outlying counties where it's not something that is at the top of their mind, like sometimes it's law enforcement too, or other elected officials that are just not quite sure what to follow. So I do know we have heard accounts from community members and students saying that this is an issue that is really frustrating.
It also kind of, because of that difference in the federal and state law, it makes it tough on the enforcement side of things. There's no teeth to the enforcement of the federal law because of the long process that it takes. And our ATC agents here in Missouri are also doing those federal law checks, and they are very limited on funding and time as well, too.
Thanks for that, Landon.
On the budget front, there is additional money that's proposed, at least in the budget for this next year, for tobacco cessation and prevention services. So that will be very helpful, and it might be possible to direct some of that towards education, if nothing else.
All right, great, thank you. Does anyone else have another question? I was looking at my little list of questions that I got here.
I don't have a question, Heather, but if no one else, I don't see any other hands. I don't want to butt in front of anyone here. Am I good? Okay.
Yep.
So just another couple pieces of legislation in this space that I want to maybe just kind of put on everyone's radar if it's not there, following along a path of education and thinking about young people and some of the conversation we've had. There is both a Senate bill and a House bill, and I will drop them in the chat as soon as I'm done talking because I can't multitask. But they are looking at legislation on setting up funding mechanisms to establish recovery high schools in the state of Missouri. So this is a little different pivot than some of the topics we've discussed so far, but it's something I know we at Prevent+Ed are keeping our eyes on and looking for ways that we might be able to support. So the concept of recovery high schools is not something new. There are many states where these have been very successful. And these are places where young people are able to attend more of a traditional high school, maybe following a treatment program, or even ideally for young people that would like to attend high school in environments where they're surrounded by other young people who are looking to live a life of that doesn't include substances or just to have a different experience in their high school years than maybe what their traditional high school offers. And so the legislation that's being proposed, there's a House bill and a Senate bill, is really setting up a concept, a pilot program per se, that will allow a funding mechanism for student funding to be able to follow them into what we would term in a recovery high school and set up some regional high schools across the state. I think this could be a very successful model. Like I said, there are plenty of examples out there. There are schools in Indiana and Texas and other states that have followed a recovery high school model that just provide students with a little different opportunity and experience in their high school years. So I'm going to drop those in the chat if it's not something, especially for our representatives or senators on still that you're familiar with. I just ask that maybe you take a look at and keep it on your radar too. For everyone else, if these start to gain any traction, we might be looking for some additional support as we go through our session here. So I don't know if representatives and senators that are on, if this is something you've looked at it all or been paying attention to, or if this is the first you're hearing of it. I'd love to have more conversation about it, so I'll stop.
Yeah, I'd like to get more information about it, Jenny.
Okay, great. I will put the links in the chat so you can pull them there, or your staff can too.
Okay. Any other questions, comments from anyone? I feel like we've addressed a lot of the hot button issues. I had a question come through, kind of a question and a statement. It says, when life or death situations occur in the state of Missouri, like COVID or fentanyl overdoses, it seems like solutions or funds are given to the least populated areas first. So, for example, COVID vaccination centers, overdose treatment centers in more rural areas. But everyone is suffering. Wouldn't it be more efficient or logical to address high impact areas first, or at least a mix of urban and rural? Does anybody have any comments on that or thoughts about that? Is that an accurate
absolutely.
assessment? Go ahead.
Yeah, it's very accurate. And again, it goes back to what I said earlier. You know, when we think about how we appropriate resources, or even what the conversation is, we should be looking at the most underserved and underrepresented communities and regions. And, you know, that's just the bottom line. And having these type of conversations just continue to heighten the facts. You know, right now, people completely overlook the fact that, you know, we have regions and communities in St. Louis, but also Southeast Missouri is one of the poorest regions in the country. And yet we still don't talk about it. And I'm not going to get into the whole political discourse because none of us have time for that. We know what that's about. But, you know, there's folks who represent very, very poor regions, but still advocate for policies that are against the interests of the folks they represent. So we got to be very intentional about that. So when we think about how we appropriate money and who we advocate for, I really do a deep dive with my staff on what parts of the regions need the resources. For example, with the federal dollars, you know, we identified areas of the region that had high addiction rates, areas that were food deserts, and, you know, and the list goes on. And we've been very intentional identifying anchors within that region to create opportunities of being able to create density. And with that density, that's outpatient healthcare facilities, clearly grocery stores, you know, things of that nature. So yes, you are correct. And two, we need to be very intentional about making sure the resources are going where needed, and that becoming the precedent on how we do things, especially as we work our way through this pandemic.
Right. I know that's.
And can I add another thing too?
Yes.
You know, when we're talking about areas of the state and their representation that they elect, you know, it's sad to say you get what you elect too. I mean, because these hospitals and other medical services have closed down and shut down in rural areas because of the policies that Republicans have passed. And if we're talking about advocacy groups, we need these advocacy groups to basically target those rural areas and educate them about the policies that the people that they elect are passing. Because that's, you know, we can only represent our districts, but people come to the urban area legislators and we can't work miracles in some of these instances. So we need advocacy groups to really target those areas and educate those individuals that live in those areas about the policies that their representatives are passing.
All right. Okay. Thanks for that comment. So anyone else on that topic? Okay. Trying to look over in the chat and make sure I'm not missing anything. I don't think that I have. Any other questions? Anything that we haven't discussed? We've got a little bit of time here.
I had a question come in. It's a little specific, so we might be something we need more education on, more than be able. I don't know if we'll be able to talk about it as much, but talking about emerging issues, I know Stacy mentioned like there are some when it comes to cannabis issues in the state, we have really limited local control in handling some of those emerging issues. And one question somebody had was, is there any legislation coming up regulating or limiting sales of Delta-8 or Kratom? And so I know Delta-8 is a cannabis product related. I can't really speak to it as much as some of my other colleagues can. I know Stacy and Jamie are very well educated on it and teach me all the time about it. And then Kratom, I haven't heard anything about in a few months. So I'm not sure if anybody has any information about that, about anything regulating or limiting sales of either of those products.
That could be a question for anyone, not even just the legislators. Does anybody have any information they want to share about?
Yeah, it has to be information provided, because I can tell you right now, I know for a fact there's a lot of people that don't even know what Delta-8 is.
Yeah. Because
I know what it is, and I would talk about it with folks because I started hearing about it in the whole like CBD space and kind of I don't know, infused THC type deal. And I didn't know what it was.
Yep.
And then to think that now you could use it in so many different ways. From what I understand, you can use Delta-8 as a vape. You can drink it as a seltzer. You could take it as an edible. So, yeah. I mean, I think that informing folks, but I would assure you that, I don't want to age myself or anybody in here, but I feel like Delta-8 is probably something that's more of a generational thing too, because I remember hearing about it for the first time, and they said that it's just, extremely popular among college students. And here I am, didn't even really know what it was.
Right. And Jamie in chat said, my youth want to know about Delta-8, Delta-10 sales as well. And then Amanda posted an article about uptick in Delta-8 poisoning in children again. So that's a great resource. Thank you, Amanda, for sharing that. But yeah, I know that is there's a lot of confusion around what is Delta-8, Delta-10, and then, what does that mean for when it can be sold unregulated, because it doesn't really qualify in the same ways as other cannabis products do.
Yeah.
So,
and they also sell it in restaurants.
Right.
So you can go into one of your favorite restaurants and you see it there and it's promoted, just as a seltzer. And people think because it's non-alcoholic that it's safe.
Goodness. Yeah, there's more information going in the chat about Delta-8. So thanks, Stacy, for that.
So before I jump off, I do have a quick question from anyone. And my mom is enjoying this conversation. She's listening to it. We're getting ready to head to lunch here soon. So I've gotten some students in high school who've reached out to me who've been advocates in terms of addressing their peers who use vape pens. Could someone just speak, to where that is, and I understand their concerns and I'm in full support of them, but is the vape pen or usage, is that something that's continuing to increase, or was it like something that was just a trend? And where are we at today in terms of the health impact, short-term and long-term?
I'm looking at my colleague Stacy, but I don't know if I want to put her on the spot. I guess I can speak on it a little bit unless someone else.
Jamie, do you have any info?
Wants to jump in? Oh, Jamie, go ahead.
I can jump in a little. It's not a trend. It's not going away. Speaking for myself, in 2019, in I think it was July, the CDC started putting out numbers about vaping related illness, which was really, this is going to sound bad. It was exciting to get those numbers, not that anyone was sick, but it was exciting to have hard data that we could walk into a classroom with and talk to students about and say, yes, now I can tell you for sure that vaping does cause illness. It causes severe illness. It can even lead to death. And it later became known as E-Valley. And the CDC was putting these numbers out once a week. Bless her heart, Kelly Weezer, one of my colleagues, was updating our vaping presentation every single week with those statistics. So we would go in and say, as of last Thursday, this is what they said. Unfortunately, because of the emergence of COVID, the CDC had to shift their focus. And so the most current statistics we have are from February of 2020. But at that time, there were still over 2,000 hospitalizations and almost 70 people had lost their lives to it. And I want to say it was something around like 85%. Don't quote me on that because it's been a minute. But around that, 85% of the patients were 35 years and under. And when discussing that with students, one thing that they could, concretely realize was this isn't the same as a tobacco illness where it takes decades. These products came on the market in 2007. And so to have serious illness where folks are dying by 2020, I mean, that is not a long-term usage situation. So Juul got into a lot of hot water because of how they were marketing their products. So now they've kind of faded out. That Juul trend has gone away, but now we've got puff bars and candy pens and like their flavors and the way they're marketing are definitely aimed at youth. Puff bar has a flavor called OMG. OMG. Now, if I said they have a flavor called watermelon, you know exactly what that tastes like. But what does OMG taste like? Well, if you read the tiny print on the label, it's orange, mango, and guava. But to call it OMG is definitely something you would use to market to youth. The colors, like all of their strategy, Juul was forced to drop the ball, but these other companies have definitely picked it up and are running it right into the end zone. And forgive me if I just messed up anything because I don't speak sport, but like they're taking this and going with it. And our youth are the ones that are suffering. Nicotine addiction is real. And I was just having a conversation last night with one of them discussing, like, I have a friend who started vaping and they want to stop and they don't know how. And, getting into situations where, it's difficult to use. We actually had a very productive conversation about what does that mean if you want to give up a substance, but all of your pals are using that substance. But anyway, it's not going anywhere. And Senator Williams, I will tell you, just to give you a little heads up, your Clayton students that work with, they're coming back and they're talking about vaping still. They were.
You knew what I was talking about, didn't you?
Together. Yes, I did, sir.
Well, I hear them, and again, any information that can be provided to me in my office that we can advocate for this. I can tell you right now, I know for a fact, because it's so subtle, these kids are doing it in school and nobody's saying anything to them. And, I see people with them all the time. It's almost like an accessory for some of these young people. So any way that we can deal with that, I'd love to be a part of that and get information. And before I jump off, I think it'll be fair. One, thank you to all of you, all the advocates, all the work that you do. Just know that I hear you, I appreciate you, and I'm here to do everything I can to be supportive, to really tackle this pandemic, which is mutually exclusive, in my opinion, to COVID. And we need to really tackle. And Heather, you get the Moderator of the Year award. You've done a tremendous job. So thank y'all for having me a part of this. I always look forward to it, and I look forward to staying in touch.
Okay, well, thank you. You enjoy your birthday lunch with Mama Williams. Tell her
I
hi
will.
from all of us. We appreciate it. And thanks for sharing her
definitely.
amazing son. So thank you.
Yeah, the one day I don't have to do something for her. So it's all good.
All right. Thank you so much. Okay, do we have any other questions? Anything else? I know we're kind of winding down on time here.
I just wanted to mention that I shared in the chat some information from the Missouri Student Survey 2020 report. If you're interested in more information, the state of Missouri is conducting the 2022 Missouri Student Survey. It's being conducted right now, actually. It'll be through March. It'll open to January through March. And so in spring, summertime, we will be getting new numbers for updated statistics on everything from e-cigarette rates to any other substance use or behavioral health related issues. So an important part of our continued understanding of this issue is full and robust participation. So we just from school districts. So we appreciate all the advocates who are on today who work to help make sure that we have a good participation from every region of the state so that we can really truly understand the substance use issues students are facing. But I just want to let you know if you're looking at, I'm always critical of data. I always want to know when's it from. If you're looking at this 2020 and wishing you had some more recent data, that will be coming soon. So.
Thanks, Kristen. Jenny, were you going to say something?
Yeah, I just have a closing thought to share too, is that our Prevent+Ed Executive Director, Nicole Dawsey, is not with us on this Zoom this morning. She is actually attending the ceremonial press conference with the Attorney General regarding the opioid abatement dollars, which were referenced earlier in the conversation by Dr. Punch and Ellis Fitzwalter. So she just texted me that if everyone's not aware, that we are anticipating in Missouri, there is a $500 million settlement that will be coming and being dispersed through DHSS, DSS, DMH, and DPS. So a lot of the topics we've talked around syringe access and other strategies to reduce the opioid overdose, especially the deaths and the disparities of deaths in our communities, I think we have some real opportunity here. So I would just say, kind of as a closing thought, to use these opportunities, as unfortunate as the cause may be, to elevate these topics and concerns and to keep using our voices and information and advocacy tools, because we know that we now have more resources coming into communities, and hopefully we can use our knowledge and our data and our research to direct those into the places that they're most needed.
Absolutely. Thank you for that. That's amazing. Okay, anyone else? If not, I'm going to give our officials, I know we've had several that have had to leave, but just kind of some closing comments or some closing thoughts. Representative Unsicker, can you?
Yes.
Okay.
Okay.
You just wanted to kind of wrap up with any thoughts that you have or anything that you feel we could do to help be better advocates for substance misuse issues?
First of all, thank you so much for having me today. I think this was very informative. I appreciate all the comments and questions. I've learned a lot about what I can do and about the just drug abuse. So thank you for having me, and I appreciate all of you and the work that you do.
Thank you for attending. Senator May. Know if you're at a place where you can speak at the moment or not, but I just didn't know if you had any comments. She may not be able.
Well, yes, I'm here. Hang on, Jessica. Yes, I'm here. Yeah, I'm multitasking, but I definitely want to thank you for this this meeting. This was phenomenal. A lot of information has went forth, and please reach out to us, send us information on ways or even groups that you think can be funded through the state. The state has criteria. I know that in this current budget, we put money in for non-for-profits and small businesses. So we definitely want to make sure that gets out. And we have been waiting for that settlement money forever, because we've been talking about it in appropriations for the last 3 or 4 years. So definitely, get in touch with us, talk to us, so that we can know that the good agencies, the ones that are actually, getting results and good metrics, can definitely get some of the funding. So that's the information that you need to get to us so that we can make sure that they get in the budget. But I appreciate everyone that's on this call. I appreciate all the questions, and thank you for the invite and letting me be a part of the conversation.
Thank you very much. Okay, any closing thoughts from anyone else? Any other groups just have a closing thought? I won't hold you all on this frigid Friday. I think we had some amazing conversation, and I'm really, really excited that you all were here and that I was able to be a part of the conversation as well. You should have our contact information. feel like we had some stuff going around in the chat. But as always, our website, prevented.org, we have all of our events and information listed on there. Thanks, Kristen. You took the words right. I don't know. All of our information listed on there. Our legislative priorities should be tabbed on there as well. So if you have any other questions for us, we're going to just probably hang around for a few more moments while everyone kind of trickles out. But I really hope that you all have the best weekend and everyone stays well. All right. Thank you so much. Bye.